So good morning, everybody. My name is Ed Conway, and I'm pleased to welcome you to the 12th Annual Norman Bethune Symposium in honor of Dr. Norman Bethune. So I'll just start off with land acknowledgement, and those of you who have walked in today really do appreciate the land, the bright colors, and it's just absolutely spectacular. So we acknowledge that we're situated on the traditional, ancestral, and unceded territories of the Coast Salish peoples, and give thanks to this land on which we live and work, and to those who have cared for it. So just some housekeeping. Please make sure you mute your phones. Washrooms are located that way and that way at the back there. Internet, there is internet access for those who aren't members of UBC visitor. There will be lots of breaks and food and drinks throughout the day, organized by Mira, who's standing at the back. During the breaks, there's posters to be seen, and there'll be awards for those posters at the end of the day. But for those who are judging, please take those opportunities to take a look. And even if you're not judging, take a look, because there's some great stuff there. I'm reminding the speakers to please stay on time. As you can see from the program, it's a busy day. We have lots to present, lots of opportunities for trainees, research associates, and others, our visitors to and lead speakers to present. For questions, there will be time after most of the sessions, assuming we stay on time, for questions and answers. We do encourage trainees and non-faculty PIs to ask questions. There'll be prizes, I'm sure, for those who ask the most, not necessarily the best, but the most questions. So we do encourage everybody to interact and ask. There's no bad questions. But please do use the microphone. So wait for the microphones to come to you, because I think we're broadcasting this elsewhere. And then there's Twitter for social media, and then I'll show this QR code later on, but this is for evaluations, which we do request, not necessarily evaluations, but more feedback on how to continue to improve the program. I can't really start without thanking those who have really done all the work, truly all the work. Mira and Caitlin, anybody who's registered or done anything related to this symposium, know that they're central to the success of this program. I'm just a bystander. And then our sponsors, important to always thank them. We really couldn't do this without their support. That's the Naaman Vickers Endowment Fund, the Canadian Blood Services, Grifols. We have representation from Grifols, I think, somewhere. Where are you? There you go. CSL Behring, I'm not sure if they're here. Yes, we do, yes. And Sobi, wave if you're here. I don't think so. Pfizer and Alexion. Alexion, we do, yes, two hands. And Novo Nordisk, and I don't know that they were able to come. But thank you to all of those donors. We really appreciate the input. So who was Norman Bethune? Norman Bethune was a Canadian physician born in 1890 in Gravenhurst. It's in Ontario, north of Toronto by 100 miles. And his father was a minister, but came from a long line of physicians or medical types who actually helped create the University of Toronto. So Norman Bethune didn't follow a ministerial path necessarily. He actually went to medical school at the University of Toronto, but then along the way he did what all Canadians do. He became a lumberjack to help support him through medical school. And then he did go back, instead of going back to medical school, actually it was World War I, and he fought, or he actually was a standard bearer for the army which is actually the British Army in Flanders, and was wounded, but then returned to Toronto, where he completed his medical school training. He was actually in the same class as Frederick Banting of insulin fame. Then he moved over to Montreal to work in the hospitals there. He was actually a surgeon. He created many instruments that were in use for decades following his stay there. But he was quite the outspoken physician with socialist leanings, and he was pretty well driven out of the university because he wanted to make sure that everybody got treated equally, which was sort of a novel concept at the time. So he ended up in Spain in the Spanish Civil War, and that's where he started to realize that the army guys, the fighters, were dying on the fields and they weren't getting blood quickly enough. They would have to be carted back. So he really established what we would call a mass unit, so mobile ambulatory services to bring the blood to the patient in the field. So that's really his, in many ways, his claim to fame. Then he was I'm not exactly sure. He was a controversial figure, so I'm not sure if he was driven out of Spain then, but he ended up in China in the Long March as the Chinese were fighting the Japanese in the late 1930s. And there he really trained paramedical personnel throughout China and throughout his stay, and subsequently died of sepsis from a wound starting an IV or something like that. He's really revered in China, continues to be there. There are Bethune hospitals throughout China. Anybody who's traveled there, you don't have to go very far to recognize that. So it's really in recognition of his contributions, not necessarily there are those who say we shouldn't because he was a communist or whatever. I don't think that's what drove him. It was what drove him was a passion to help people and to improve healthcare, and that's really why we recognize him at this symposium. And so here we are 12 years later doing what we do best. Now, so I'm going to start the program.